I'm here today with Bupa's Physioline lead therapist, Sarah Griffiths, who is going to talk us through what to look out for when we notice pain after exercise. What are the differences between niggles and injuries, and what we can do to ease ourselves back into exercise post-injury. So Sarah, what are your top tips for people who are recovering from injury, trying to get back into exercise, and how can we tell the difference between, that muscle soreness because you've done a bit more than usual to something that's a bit minor to something that's more serious?
Sure. So when I'm looking at whether this is a niggle or whether it's an injury, there are 5 things that I look out for. So one is, has there been a severe sudden onset of pain that stopped you in your tracks and you can no longer exercise? The second one is, it doesn't improve with rest. That's an indicator that it may be an injury rather than a niggle, where it tends to improve without any intervention. 3 is anything other, so thinking about swelling, bruising, tenderness or heat to the area. Again, an indication it could be an injury over a niggle. The 4th thing is it a recurrent symptom? So is it happening at the beginning of exercise, in the middle and after, and is it happening all the time? So niggles can turn into injuries, so it's important to look out to see if this has occurred before. And finally, past medical history. Are you aware that that person has injured their knee or hip previously? It may be an indicator that it is a reoccurring injury.
For people who love moving their bodies, love exercising, after injury, that natural reaction is to just want to get back to it straight away as soon as possible. Do you see that?
All the time, treat patients all the time where as soon as their injury is recovered, they want to jump straight back into the exercise. So we really want to think about a gradual return to exercise, and something that can help with this is sort of short-term and long-term goals. So setting small, gradual goals, tracking your process to a long-term goal, such as a 10k race.
Right. Can we speed up our repair and recovery?
Yes, there's certainly things we can do at home. So self-help techniques. So we follow sort of the police and harm principles. So harm is avoiding anything that may make the injury worse. So avoiding heat, alcohol, running or high impact exercise and massage in those sort of first few days. And then things we can do to help are protecting the joints. We may need a period of rest, but then we really want to get back to that optimal loading. So getting back to weight bearing activities as soon as possible. Ice can also help, compression and elevation.
I think people used to think you just have to rest, don't you, completely, but now, initial rest, but gradually starting to try and keep things moving, because otherwise you get stiff all over, don't you, if you don't keep moving?
Yes, that's right. Movement is the key to recovery.
And then once, finally, the injury is recovered, how can people ease back into their typical exercise regime?
Yeah, so we touched on this earlier, but again, really thinking about setting those short-term and long-term goals, making sure that we don't do too much too soon and end up with further injury.
Well, fantastic, Sarah. Some really great information and advice there. And don't forget, you can get more support with exercise and wellbeing in your My Bupa app.